Human Metapneumovirus, HMPV, is a respiratory virus that has garnered increasing attention since its discovery in 2008. Belonging to the Pneumoviridae family, HMPV is closely related to other respiratory pathogens, such as respiratory syncytial virus, RSV. It primarily affects the respiratory system, causing a range of illnesses from mild cold-like symptoms to severe respiratory distress. HMPV is highly contagious and spreads through several mechanisms. Respiratory droplets, where the virus can be transmitted when an infected person coughs, sneezes, or talks, releasing droplets into the air. Direct contact, where physical contact with an infected individual can facilitate transmission, especially if one touches their face afterward. Surface contamination, as HMPV can survive on surfaces for short periods. And touching contaminated objects, such as doorknobs or mobile devices, increases infection risk. And airborne particles, where small respiratory particles may linger in the air, particularly in crowded or poorly ventilated spaces. The incubation period for HMPV is typically between 3 to 6 days, during which an infected person may be contagious even without showing symptoms. This asymptomatic phase complicates containment efforts. Symptoms of HMPV can vary significantly based on age and overall health. Common symptoms include persistent cough, nasal congestion or runny nose, fever, typically mild to moderate, fatigue and body aches, sore throat, and shortness of breath in severe cases. In children, particularly those under 14 years old, symptoms can be more severe and may include breathlessness, wheezing and persistent cough, high fever, and poor feeding and dehydration in infants. Severe cases of HMPV can lead to complications such as bronchiolitis, pneumonia, and acute respiratory distress syndrome (ARDS), especially in vulnerable populations like infants, older adults, and individuals with compromised immune systems. Diagnosing HMPV can be challenging due to its symptom overlap with other respiratory infections like influenza and COVID-19. Specific laboratory tests are required for accurate diagnosis, including reverse transcriptase polymerase chain reaction (RT-PCR), which detects viral RNA in respiratory specimens, and serologic testing, which measures antibodies against HMPV in the blood. Currently, there is no specific antiviral treatment or vaccine for HMPV. Management primarily focuses on supportive care aimed at alleviating symptoms. This may include rest and hydration, over-the-counter medications for fever and pain relief, and in severe cases, hospitalization may be necessary for oxygen therapy or mechanical ventilation. Preventive measures are crucial to curb the spread of HMPV, including hand hygiene, where regular hand washing with soap and water or using hand sanitizer can help reduce transmission. Respiratory etiquette, emphasizing covering the mouth and nose while sneezing or coughing, avoiding close contact with infected individuals to limit exposure, and surface disinfection, where regularly cleaning frequently touched surfaces helps minimize the risk of surface contamination. HMPV infections often peak during winter and early spring months. Recent outbreaks have highlighted its potential severity, particularly among children and immunocompromised individuals. Health authorities emphasize the importance of awareness and preventive measures to protect vulnerable populations. Human Metapneumovirus represents a significant yet often overlooked respiratory pathogen. While most infections are mild and self-limiting, awareness of its potential severity in certain populations is crucial. Ongoing research into vaccines and antiviral treatments will be vital in managing this virus effectively in the future. Understanding HMPV's epidemiology, transmission dynamics, and clinical implications will aid public health efforts to mitigate its impact on communities worldwide.